Hi, my name is Dr. Jilan Koch. I'm a naturopathic doctor here in Newmarket, Ontario, and today I'm going to show you how to resolve a chronic sinus infection that's just not draining properly, especially if there's ear involvement. So you're going to need a couple of things. You're going to need a bowl with warm to hot water, a cloth that you can use as a compress, a cream that is natural and very clear and free of toxic ingredients, or this is one of my favorite creams. It's Lymphadirol Drainage Cream by Pasco, and it's the sensitive formula. So the first thing that you're going to do is you're going to take your bowl of hot water and your compress, and you're just going to wring it out and hold it over the sinuses and the eyes. And do that for a couple of minutes. You can re-wet and drain and put back on your face as many times as you need to get that warm feeling. And after a couple of minutes, you can take it off, and then you'll start the massage process. So with the massage process, it's easier to do on yourself, but I'm going to show you how to do it onto somebody else. You're going to take a little bit of the cream and just put it on the tip of your finger. Please note, a little goes a long way, and it is important to wash your hands prior to doing this. So you're just going to spread it around and start just on the inside of the eyebrow and use good firm motion as you go around. You're going to do the same on the other side using good firm pressure. And then you're going to go to the bridge of the nose where there's that cartilaginous material, and again applying that pressure, you're going to start to move down to either side of the nose and down to either side of the nostril. You're going to continue this massage process by following the bone below the eye and just moving outward. You can repeat that a few times just to get that movement, and you'll know when it feels good. You might notice a little bit of tenderness. That's okay. That's showing you that you've got mucus accumulation in there. So once you've done this, you're going to want to make sure that you're moving things from the small lymphatic chains or vessels to the larger ones. So again, you're going to use the cream that you've got, and you're going to start in front of the ear and really move in circular motion down the front chain of the lymphatic system. You're going to do the same thing, so I need a little bit more cream. And you're going to do the same thing by following underneath the ear and moving out. It can be ticklish, it can be sensitive, but you're going to push through, and when you're coming down the front, you're bringing it right down to the clavicle. When you're doing underneath the ear, you're going to go out laterally, right out towards the shoulders. The last part that's really important is finding that bone behind the ear. That's the mastoid process, and you are just going to start underneath. If there's an ear infection, you might find that the lymph nodes here are a little bit swollen. And you're going to go in circular motion down the back of the cervical chain, down to the back of the body as well. A couple things that are really important to note is if you've got a lot of neck, shoulder tension, the sternocleidomastoid, it's the muscles that come down attaching from the head to the clavicle, they're going to feel pretty tight, and they might be blocking that lymphatic fluid. So make sure you're doing some good massages in over the muscle. Stretch out your neck, take a hot shower if you need to, but let's get things moving so that you can get over this cold and this congestion nice and fast. Thanks so much, wishing you lots of luck and a speedy recovery.